All right, today we're diving into two drugs you've almost certainly heard of, especially if you've ever dealt with nerve pain, gabapentin and pregabalin. Now, they sound alike, they're used for similar things, but as you're about to find out, there is a surprisingly complex story hiding behind those names.
So you've probably wondered, right? What is the real difference here? Is one just flat out better than the other? Does it come down to how well they work, what they cost, or how safe they are? Let's get into it and figure this out.
So to get to the bottom of this, here's our plan. First, we'll look at how they're related. Two drugs, one family. Then we'll get into the cool science of how they actually work. After that, we hit the big debate, efficacy versus cost. We'll check out their safety profiles and then wrap it all up with what we're calling the doctor's dilemma.
Okay, let's start with part one. Two drugs, one family. Because before we can talk about how they're different, you gotta understand what makes them so alike in the first place.
Both of these drugs are go-to weapons for something called neuropathic pain. And listen, this is not your everyday headache or a pulled muscle. We're talking about a nasty, chronic kind of pain from the nerves themselves just misfiring. People often describe it as burning or shooting, like an electric shock. And for this exact condition, these gabapentinoids are considered a first-line treatment.
And here's where their story starts. See that molecule at the top? That's GABA. It's a super important neurotransmitter that helps keep our nervous system calm. Now look below at gabapentin and pregabalin. They were literally designed in a lab to mimic GABA's shape. You can think of them as structural or chemical cousins.
So if they're designed to look like GABA, they must work like GABA, right? Well, not exactly. The science is actually a little more sophisticated, which brings us to our next section.
This diagram shows what's really going on. With neuropathic pain, your nerve cells are basically on high alert. They're letting way too much calcium in, which makes them release a flood of pain signals. So what gabapentin and pregabalin do is they latch onto this very specific part of that calcium channel. And by doing that, they essentially slam the gate shut. This calms the nerve down and stops that flood of pain signals. They literally quiet the storm at a cellular level.
So, okay, they're from the same family, they work the same way, you'd think they'd be pretty interchangeable. But now we get to the real heart of the matter, the central tension in this whole story. Efficacy versus cost.
Let's start with how well they work. A huge review of studies on PubMed, we're talking data from over 3,000 patients, came to a really clear conclusion. Pregabalin wasn't just better, it was also faster at relieving neuropathic pain. So, case closed, right? Pregabalin is the obvious winner.
Well, not so fast. Because in the real world of medicine, how well a drug works is only ever half the story.
And here's the other half. A big cost-effectiveness study found that the average cost for a course of gabapentin was just $4.68. Pretty cheap.
And in that exact same study, for the same thing, pregabalin, $26.41. I mean, that is a huge difference. We're talking more than 5 times the price.
This brings us to a really critical point from that study. The researchers said that even though pregabalin works a little better, gabapentin's rock-bottom price makes it a more economically efficient choice, especially in healthcare systems where every dollar counts. And that completely changes the conversation.
So now we have the more effective but way more expensive drug versus the cheaper but slightly less powerful one. Let's add one more crucial piece to the puzzle, the safety profile. Which one does the body actually handle better?
Okay, this table shows some really big differences in how our bodies process these drugs. Look at bioavailability. That's how much of the drug actually gets into your system. For pregabalin, it's super predictable, over 90%. But gabapentin, it's all over the place, anywhere from 27 to 60%, and its absorption just kind of maxes out at higher doses. On top of that, pregabalin works faster, and you don't have to take it as often. That predictability is a huge win for pregabalin.
But when it comes to side effects, they're suddenly twins again. For both drugs, the most common complaints are things like dizziness, sleepiness, what doctors call somnolence, and trouble with walking or balance. Weight gain and blurry vision are also on the list. And for some people, these side effects can be a total deal breaker. And there's one really serious warning that applies to both. Health agencies have flagged a risk of severe respiratory depression, which means your breathing can become dangerously slow. And this risk gets much, much higher when these drugs are taken with opioids, a combination that, unfortunately, happens a lot and is a huge public health concern. So all of this brings us to our final section, the doctor's dilemma. We've seen all the evidence. Now, how does a doctor, sitting with a patient who's in real pain, actually make a choice? Let's just sum it all up, head to head. In gabapentin's corner, you've got its low cost and economic efficiency. But it has that unpredictable absorption and needs more daily doses. Then in pregabalin's corner, it's more effective, it's faster, and its absorption is clean and predictable. The downside, that big price tag and some data that suggests it has a higher potential for misuse.
So here's the big takeaway. There is no single better drug here. It's just not that simple. The right choice is completely dependent on the context. What does this specific patient need? What will their insurance cover? What are the economic realities of the hospital or clinic? This is a perfect example of where medicine stops being just a science and becomes more of an art.
And really, this whole thing perfectly illustrates a much bigger question we all have to grapple with, far beyond just these two drugs. It's this constant tug of war between innovation and access. So we'll leave you with this to think about. When it comes to medicine, how do we, as a society, balance what's most effective with what's most affordable? It's a tough one, and there are no easy answers.